ask each panelist a question, and I'll start with you, Deborah. What advice would you give to peers at hospitals? You have an IT peer that has been approached by hospital leadership to implement something like EndoTool, and they're a little bit skeptical. What advice would you give to them to move forward?
The best advice is, as everyone from the clinical side has noted, make sure you're working as a team together to build what is best for the patient safety and the patient care protocol. So take the time to invest in proactively saying, hey, we need EndoTool. Look at your resources. Look at your champions that's pushing for the need of EndoTool. And then look at the prioritization of what else is on the plate of IT as well as the clinical staff, and work together as that unit of one, and it would make the whole process much easier.
Excellent, excellent. How about you, Rana?
I would say the concern of nursing education, getting to know EndoTool, it is minimal compared to the amount of confidence that they will receive and the ability to just move through and increase their knowledge of what happens during a diabetes crisis, a DKA and HHS, hyperglycemia, what is happening. So they're not so much fixed on what do I need to do now, but what am I learning about this and how can I help the patient? And patient safety up and above is the most important thing. You're going to have confidence that the patient is getting the best insulin infusions that they can based on a lot of predetermined knowledge and research on EndoTool's part. So it's really helpful for our nurses that they're very, very confident and they feel that they don't have to run around asking questions and being a little bit unconfident of what they were going to do previously.
Yeah, nursing confidence is a great thing for sure to drive great outcomes. How about you, Melissa?
I think, as was mentioned before, the flexibility that EndoTool offers has been helpful for us because it takes into account patient-specific factors that we could not work into our paper protocols. Has been very helpful. That standardization is something that gives us a lot more confidence in how things are managed, and has been something that, as people kind of get introduced to the subject of EndoTool beyond just our CSICU, everyone's really excited. Our clinical folks are excited about it coming, especially those who've used it elsewhere have been really excited about being able to have this standardization so that essentially everyone gets the same care across the board. And it's good to have that buy-in from our clinical team members so that it really kind of motivates our IT team to be like, well, what do we have to do to kind of get it in place so that everyone can use it where it needs to be used.
Great, thank you. Two more. Scott, how about you? You sort of made a compelling case already, but what advice would you give to other CMIO colleagues in particular?
The identification of a clinical champion, I don't think can be understated. And we were fortunate enough to have one of our nursing educators who had been around for a long time and already had the confidence of the rest of the nursing staff, really took a passionate approach to implementing EndoTool. And so finding that champion, allocating time to that person to really learn and digest how this tool works. Because if, at a hospital, yes, it sounds great. You can turn over the management of an insulin infusion to a predictive analytics tool, but for folks to gain trust in it, that it's actually going to give them good advice, that was part of the initial hump to get over. And having a trusted internal colleague who was able to speak very knowledgeably about how the algorithm worked and the data behind it, and really champion it and give folks the reassurance that this is actually going to be a good thing for us, was probably one of our most important aspects of achieving the adoption that we achieved. And so I think the biggest advice would be make sure you have that clinical champion in place and that you allocate enough time for that person to do a good job, and let them connect with the folks that need to be connected with in order to help them gain trust in the system.
Sort of generate a lot of credibility.
Yes.
It's key. And
Yes.
yeah, it's interesting amongst providers. They often have a lot of skepticism that such an electronic tool can really replace what they're doing, and it can replace it and get outcomes at 10 times better than what they were getting. But so you
Yes.
can really demonstrate that. And Allison, you're at a pharmacy meeting and you're talking to another pharmacist who has been approached about implementing EndoTool, and they're a little bit skeptical. What advice would you give to them to take back to help drive adoption?
Certainly, many of the points provided already, the straightforwardness of dosing, the ease of dosing, the avoidance of hypoglycemic events. One of the features that I've really been trying to champion and increase use of here is we use the IV application right now, so we're still using IV infusions as the tool to do the transition to subcutaneous insulin utilizing EndoTool recommendations, and I think that has been great for our patients, and it's one of the places where we see that same hesitation about relying on technology or AI. There's always this hesitation to rely on technology to do these things, but being able to refer to also like being very aware of our clinical parameters, and knowing that while it is an application with a significant level of automation, at the same time, we locally are in control of a lot of the clinical factors, and able to personalize things to what our providers feel is best. We're able to make changes if we were to ever need to be agile and make an adjustment. So I think all the features beyond just the insulin dosing itself, the hypoglycemia management, the transitions to subcutaneous are also what make it a very user-friendly and clinical-friendly application.
Right. Yeah, that's a good point. That there's still room for clinical acumen and modification. If you're a little concerned that the dose needs to be increased or decreased, you can do that, and there's that variability that's present as well.